Hello everyone, I am Dr. Shashi Kumari from MBBS 2020 batch KGMU. Today we are going to discuss perineal body and superficial perineal pouch. This is very important topic for your first professional exams. So before going to main topic, let's discuss some basic background. Perineum. It is the region inferior to the pelvic floor, which is also known as the pelvic diaphragm, and it lies between the lower limbs. So here we can visualize the pelvic diaphragm and below which it is the perineum. It is the lowermost portion of a pelvis. Perineum support the pelvic organs including bladder, uterus and rectum. In the lithotomy position, this is how perineum appears in both male and female. In males, perineum is traversed by urethra and anal canal, and in females, it is traversed by urethra, vaginal orifice, and anus. In the diagram, we can see the boundaries of the perineum. Anteriorly, we have the pubic symphysis. Laterally, we have the ischiopubicramide, and posteriorly, we have the sacrotuberous ligament and coccyx. The perineum is divided into two triangles. Anteriorly, we have the urogenital triangle, and posteriorly, we have the anal triangle. And here between the two, we have the very important structure, perineal body. So let's discuss about perineal body. Perineal body. It is the fibromuscular node situated in midline. As we just saw, it is present at the junction of urogenital triangle and anal triangle between the lower ends of vagina and anal canal. To be very precise, it lies about 1.25 cm in front of the anal margin and close to the bulb of penis in male and posterior wall of vestibule of vagina in female. This is how perineal body looks like. 10 muscles of perineum converge here. We have 4 paired muscles and 2 unpaired muscles. Paired muscles are superficial transverse perineal muscle. Just below this lies the deep transverse perineal muscle, which we cannot visualize over here. Then we have the bulbospongiosus muscle, and then levator ani muscle. It has 3 components, but only 2 muscles forms perineal body: pubococcygeus and iliococcygeus. And to be noted, ischiocavernosus is not a part of perineal body. Now, unpaired muscles are external anal sphincter and longitudinal muscles of anal canal. This is a schematic diagram of perineal body. So what's the significance of perineal body? It is extremely important in female in maintaining the integrity of pelvic diaphragm and providing support to the pelvic organs. If it gets injured, like during difficult childbirth, or it may get cut during giving episiotomy, this may result in prolapse of the uterus, bladder, or rectum. Our next topic is perineal pouches or spaces. In the starting, we discussed about perineum, which was divided into 2 triangles. Anteriorly, we have the urogenital triangle, and posteriorly there was anal triangle. So this urogenital triangle is the area which contains these 2 pouches, that is superficial and deep pouch. This triangular tough facial sheath called perineal membrane, which stretches across this triangle and is present between superficial pouch below and deep perineal pouch above. Here we can see the perineal membrane, which is also known as the inferior layer of urogenital diaphragm, and above we have the deep perineal pouch, and below we have the superficial perineal pouch. Among this, superficial perineal pouch is very important, so let's discuss it in detail. As we learned, this is the superficial space of the urogenital region situated superficial to the perineal membrane, and its boundaries are: perineal membrane forms the roof of superficial perineal pouch, and floor is formed by the colles fascia, which is the extension of the superficial layer of abdominal wall called scapula's fascia. Laterally, we have the ischiopubic ramus. Posteriorly, it is formed by the fusion of perineal membrane and colles fascia, and anteriorly, it is open and continuous with the spaces of scrotum, penis, and anterior abdominal wall. This is the perineal membrane, and this is the colles fascia, and it is the fusion. Colles fascia is fusing with the perineal membrane posteriorly, and anteriorly it is open. This is the coronal section of the urogenital region, showing contents of the superficial perineal pouches in both males and female. This is the comparison of structures within superficial perineal space in males and females. Let's discuss. In males, we have root of penis, bulb of penis along with the bulbospongiosus muscle, crus of penis along with the ischiocavernosus muscle. Then we have the superficial transverse perineal muscle and ducts of bulbourethral glands. Urethra within the bulb of penis, and we also have the branches of internal pudendal artery, perineal artery, dorsal artery of penis, deep artery of penis. Then we also have the branches of pudendal nerve, perineal nerve, and dorsal nerve of penis. In females, we have root of clitoris, bulb of vestibule covered with bulbospongiosus muscle, crura of clitoris covered by ischiocavernosus muscle, and superficial transverse perineal muscles same as that of males, greater vestibular glands, Bartholin glands. Then we have the urethra. Here also we have the branches of internal pudendal artery, perineal artery, dorsal artery of clitoris, deep artery of clitoris. We also have branches of the pudendal nerve, perineal nerve, dorsal nerve of clitoris. Let's discuss the applied aspect. If there is injury caused to the membranous urethra, urine extravasation takes into the deep perineal pouch, and if injury happens to the bulbar urethra in males, extravasation of urine happens in the superficial perineal pouch since it has deficient anterior wall. First of all, urine extravasate into scrotum, then anterior abdominal wall, then thigh. Thank you.